Hi everybody, it's Big T and I'm back with another video. Today is Tuesday, November 8th, which means it's election day here in the United States. I just got back from casting my ballot, so that's a win for democracy right there. Don't worry, this is not a political video. I'm not going to get into who you should vote for or anything like that. But what I do want to talk about is 10 things that you can expect after weight loss surgery. I know I've talked about a few things here and there, shared some of my experiences, and the reality is some of your experiences might be different. So if you don't like something that I say and that makes you scared to get the surgery, don't let it scare you, because every single thing that I talk about is bearable. You're able to get through it. I survived getting through it. Many other people who've had surgery got through it. There was 6 other people who got the same surgery I did on the same day. I was the last one of the day, and so we all got through it. We're all surviving. We're all past the worst of it, and so you can too. Don't let any of this dissuade you. But I think what makes it important, if you're going to go through this process, is if you know in the back of your mind what you're going to have to go through, it makes it easier. But before I get into these 10 things you can expect, please do me a favor and subscribe. Press the subscribe button down below. Maybe leave a comment. Let me know that you enjoy this type of content, or that there's other types of videos that you want me to make. Like the video, please share it, do whatever you can to help get the word out about my channel. I would really appreciate it. But here we go, 10 things you can expect after weight loss surgery. And number 1 is you're going to wake up in pain. Pain is one of those things you're going to have to deal with, and it might be something that scares you to death. You're afraid to get the surgery because you're going to have incisions. You're going to have about 5 or so incisions. That's how many I had. Maybe if you're smaller, you're going to get away with 4. I don't know. But I did wake up in pain, and the pain medication wasn't helping as much. They were giving me Dilaudid, but yeah, the first few days were horrible. When you wake up, that's the first thing you're going to feel is, oh my gosh, somebody just punched me in the stomach. It hurts. I don't know what to do. Please give me some pain meds. And they're going to try to make you comfortable. They're going to do their best. Again, I thought that they didn't have the IV in right, so that's why the pain meds didn't work for me. But when I got my gallbladder surgery out, it did work for me. So you're going to be different. Your tolerance to pain medication might be lower or higher. It depends, but you should still expect that you're going to wake up in pain, and for the first few days, you're going to be in a lot of pain. Which leads me to number 2, which is, depending on your doctor, do not expect a lot of help with pain medication. I know I just said they're going to try to make you comfortable, but that's while you're in the hospital. When you're in the hospital, right out of surgery, they're going to give you as much as they can to help you feel comfortable as you come out of anesthesia, as you get stronger. But after that, if you're in the hospital for a few days extra, like I was, yeah, they're going to continue to help you out, but they're only going to give you it every 4 hours. And so pain medication for me lasts an hour at most. So 3 hours later, I'm still waiting. I'm in pain. I'm waiting for that next shot, and I feel like I'm begging them, please give me some more. And that's how it was for me. And but they're going to keep you on a schedule. And when you actually leave the hospital, my doctor at least gave me 5 Norcos. And so that's what you're going to have to expect. Most doctors, and they made it plain when they said, we're going to give you 5 Norcos, so expect that. And afterwards, you're going to have to take Tylenol. You can't take any NSAIDs because that leads to bleeding, so you're going to have to rely on Tylenol after your 5 pain meds are gone. So that's just my doctor. Hopefully your doctor is different. Hopefully they're a little more understanding if you're in a lot more pain. And that's just something you're going to have to expect. You're going to hurt. It's going to be sore. You're going to have to deal with it. And they might not be so helpful for you after your surgery. And they also made sure to tell us, don't call the office asking for more pain meds. You're not going to get them. And that's just the way it is. They're trying to wean patients off of using pain medication after surgery. Number 3, they will want you walking on the first day to prevent blood clots. That's going to be horrible. I'm telling you, when you have to get up for the first time right after surgery and you have all those incisions on your stomach and it hurts, the last thing you want to do is get up. And getting up involves you twisting. You're going to have to move your body, move your legs over the side of the bed. You're going to have to twist. You're going to have to grab onto somebody, and they're going to pull you up, and it is going to hurt. So be prepared for that. Be expectant for that. They want you walking that same day, and there's no tolerance. They're not going to say no. You're not going to be able to say, no, I don't want to walk. You're going to have to get up. You're going to have to walk. And along with that is number 4, is that they're going to want you to use the bathroom and pass gas. One of the first things they were asking me is, have you passed gas yet? Have you passed gas yet? And so that, along with, have you gone to the bathroom? Have you peed yet? Have you defecated yet? Those are the things that they're going to continually ask you because they want to monitor that. They're not trying to be gross or anything, but they want to make sure that your whole digestive tract is working correctly. And if you're eating even the littlest bits, you might have a hard time going to the bathroom because you're going to be on a liquid diet for at least a week before your surgery. So you're not going to have a whole lot of feces to pass at that time. But passing gas is one thing. Urinating is another thing. They're going to expect you to get up and go to the bathroom and urinate. That's going to be painful as well, but it's part of the process. They want to make sure there's no blood in your stool or in your urine, and there absolutely shouldn't be. I didn't have any problems. Everything was normal on my end. But if you're internally bleeding from the surgery, that's going to be a good tell that shows that there's a problem and they need to get back in there. So they're going to want to monitor your gas, your urine, and your defecations to make sure that everything is working, the stitches are holding, and you're doing well. Number 5 is that you're going to need to rest at least a month after surgery. At least a month. They tell you if you can take a month off of work, do it. You're going to need that time. You're going to need to recover. Even after a few weeks, if you're feeling better, you're not feeling much pain, everything is sort of settled down in your stomach area, you're still going to need to rest. And that includes no lifting, no grocery shopping, no work, at least 2 weeks to a month, depending on your job. Even if you have a desk job, take those 2 weeks and rest and recover. No usual chores. You will be tender and sore for a while. I was feeling good, and I told you guys yesterday, if you watched my video, that I had an active weekend, I had a lot of fun, and I was feeling pretty good. I wasn't feeling any pain, but I sort of noticed some tenderness in my stomach area, because over the weekend I was lifting the gravy and twisting and dumping and walking around and doing that. So being active, there was a little bit of twinge of soreness in my stomach area. So you're going to experience that. You're not going to feel like getting up and cleaning and doing your usual chores. Even going to the bathroom is going to be difficult. So you're going to need to rest. If you have a difficult job that has a lot of labor involved, you're lifting things, you're moving things, you're going to want to wait at least a month before you go back to work. So that's something that you should expect. Number 6, expect financial difficulty after surgery. If you're taking 2 weeks to a month off of work to recover, but you work to pay your bills, you're going to have a difficult time. I'm having a difficult time right now financially because I took 2 weeks off and then my editor was sick, so I've been off for 3 weeks, and that's going to be another few weeks before I get paid. So I'm kind of worried right now. I'm stressed out about my finances. There's going to be no money coming in for a full month. All of my bills are going to be due. I'm really going to be struggling here. I'm on the verge of losing my truck. I'm trying to find some money to scrape together to see if I can pay that off for the month. I got to pay my internet bill so I can keep working. I got to pay my light bill. There's a lot of bills that are due, and if you're able to save some money before surgery, do it. Save as much money as you can. That's going to be important because afterwards you're not going to be able to make money. You're not going to be able to go to work the next day or 2 days or 3 days after. You're going to need absolutely 2 weeks at least minimum before you're able to go back to work. And it's not just your incisions and your stomach pain that you're going to be dealing with. You're going to be learning a whole new way of eating. You're going to be dizzy. I was dizzy for at least 3 or 4 days after surgery because your body is adjusting. You're eating very, very little. You're not able to get in much nutrition. Even if you're taking all your vitamins and doing everything right, you're still going to struggle. You're still going to feel weak. You're going to be tired. Your body needs time to adjust. So give it that time to adjust and recover. And if you do so, expect that there's going to be some financial difficulty. Maybe you have friends and family who can help you out. Maybe you can save some money. And if you absolutely have no other options, maybe put your surgery off a little bit. I didn't feel like I had a choice to do that. They might just give you a date and say, this is your date, this is when you're getting surgery, this is the time, be there. You can cancel and move it forward, but if you keep doing that, you might never get it. So I felt like I had to do it. This was my one shot to do it, but now I'm struggling a little financially. So you should expect that after weight loss surgery. If you're the breadwinner, if you're someone who works and pays bills and you need to take some time off. So don't expect that you're going to be able to rush back, and at the same time expect you're going to have some financial difficulties if you don't have any money saved. Number 7, you will need a lot of help doing things such as shopping, cooking, and cleaning. Again, I mentioned before, you're not going to be able to do those things. In my 600-pound life, Dr. Now tells people, 1, they need to move to Houston if they don't live in the area, and 2, they need someone to move with them, because during recovery, they're not going to be able to do their normal things. They will not be able to do chores. They will not be able to cook for themselves. They will not be able to go grocery shopping. One of the things that my doctor set me up with on the list, he said, do this shopping at least a week before your surgery, or that week during, before your surgery, because after surgery, you're not going to feel like going grocery shopping. You're not going to be able to. You're not going to be able to lift things and carry bags inside. You're not going to be able to do any of that. You're not going to be able to take the trash out. Like, these are things you're going to need help with. So before you have surgery, find somebody. If you live alone, find somebody who can help you for at least a few weeks afterwards. Have them come check on you. Have them help you out. If you're not able to cook, making something like tuna is going to be simple once you're in the puree stage, of course. But yeah, you're just going to have to be prepared to have other people help you do some things: shopping, cooking, cleaning, carrying the trash out, doing those things that you couldn't do. Even taking showers is going to be a little difficult. So I don't know if you can have anybody help you do that. You probably don't want to. That's a private thing. But yeah, everything you do is going to be difficult for a little while. So be prepared for that. Have somebody to help you along that process. Number 8 is head hunger, especially after watching ads. Your hunger is going to decrease, but your cravings do not decrease. You're still going to crave the same food. You're still going to crave the Taco Bell. You're still going to crave the McDonald's and the Burger Kings and the pizzas and whatever. Those things, the ads, they blare constantly. You're going to want those things. You're going to want to eat like you used to. But your hunger helps you out. You're not so hungry, so you can eat a little bit of tuna and be satisfied. But still expect that the cravings are not going to just go away. You're going to want those things. You've been eating those things your whole life. You know what they taste like. They taste great. You're going to want to eat them again. But you're going to have to work hard and just not splurge on it. You're going to have to get satisfied eating the small things that you can eat. And along with that, remember that when you go to a family's house, when you go to your family's house, or if you go out to eat with friends, or you go to the movies and there's popcorn, and all these things that you're not able to eat are going to be around you constantly. Do not blame other people in your life because they are not eating the same way you are. You're on this journey, and you can't expect them to eat your watery potatoes. Like, they're not going to do that. Like, if you invite people over or you have family, they're going to eat all their normal things. And I remember on my 600-pound life, a lot of people were getting angry because, like, why are you bringing this McDonald's into my house? You know I can't eat it. And just getting mad at their family members. You can't do that. Just be around them to socialize. Socialization will help you. It'll help you heal. It'll help you get over some of that depression, just being around other people. But don't get mad at them for eating like normal. Don't get mad at them when you go out to eat and you can only eat just a little bit of food. Maybe you order a kid's meal's worth of amount of food and you could barely eat that, but they're getting mounds of food on their plate. Don't get mad at them. Expect that the cravings are going to be there and that you cannot indulge in that. Thanksgiving's coming up. Christmas is coming up. I've already told you guys that's going to be difficult for me. But hey, I'm going to have to endure it. I'm going to have to keep on my diet and keep going because that's the journey that I chose, and that's what it's going to take for me to win. And it's going to be tough, but I'm going to do it. So, number 9, you're going to have to eat and sip slowly. If you're like me, I guzzle my water, I scarf down my food quickly. I'm a fast eater and drinker. everything I do is fast. That's just me, my ADHD ways. I eat and drink fast. I love gulping down water, but you can't gulp down water in food. You just can't do it. You have to sip, and you have to sip, and you have to chew and chew. You have to eat very slowly and drink slowly. So if I have my 50 ounces of water every day, they want you to have 62 ounces, but you're not going to be able to gulp that down and just, okay, go get some more water. You're going to have to sip it throughout the day and remember throughout the day, oh, I need to keep drinking. I need to keep drinking. I need to keep drinking. You have to remind yourself that throughout the day, and that's going to be difficult, especially if you are a gulper. It's going to be tough to learn that, but your stomach can only handle so much food and liquid at one time that, every 2 minutes or so, you're going to have to take another sip and take another sip, and just throughout the day, you're going to have to remind yourself to do that. And another thing is you must sip your water throughout the day to get 64 ounces. So if, a few ounces per every few minutes that you sip and you get a few more ounces, to get your 64 ounces, you're going to have to do that throughout the day. You can't stop drinking water. It's just going to be part of your life now, and you have to do it slowly. You can't eat and drink at the same time. If you have a meal like me, I'm in the puree stage. I just had some tuna before I started this video. I have to wait 30 minutes after I eat before I can start drinking again. Something else I've done my whole life is eat and drink at the same time. I've always had a drink with me. I'm always thirsty, so I drink all day long. Even when I'm eating, I'll take sips of whatever while I'm eating, but that's something you can't do at the same time, because again, your stomach pouch is very small, and if you put food in there and then you immediately drink water, it sort of funnels the food through, and then your body doesn't have the chance to absorb all those minerals and things and nutrients that you need from that food. So it's pretty much like not eating it. It's just a waste. And so you have to wait 30 minutes after you eat before you can drink again. That's just part of it. So you can't eat and drink at the same time, and you must chew, chew, chew. So that's another thing. Sip, 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 and chew, chew, chew. I know I'm saying those words a lot, but yeah, it's you can't have any big chunks in your food when you eat. Like if I have tuna and it wasn't blended well enough, I'm gonna have to chew it, and I'm gonna have to keep chewing it. If you swallow a big piece of food, it will get stuck before it goes into your stomach. And it can get stuck there, and you can try to get it out, and you might not be able to, and then you vomit it out. Either you're going to vomit it, or it's going to be stuck, and you're going to have to go into surgery to have it removed. So that's just the way it is while your stomach is healing. It's going to be inflamed. You're not going to be able to get as much food in there. So the capacity is smaller, and things get stuck. And if it gets stuck, it's either going to have to be vomited out or surgically removed. And so you have to chew it really well. And so if you're used to just taking a few bites and chewing it just a little bit and swallowing, big chunks of food or whatever, you can't do that anymore. You're going to have to chew your food really finely, really well. Make sure it's a puree stage before you swallow it. And that's just the way it's going to be. And so finally, number 10, expect a lot of burping. After you eat food, you're going to burp a lot. I just ate tuna. I've been trying to suppress burping while making this video because I know that's gross. But you're always going to feel like you got to burp. It's always right there. And sometimes it's stuck there and you're like, oh, come on, just burp. Just burp. Like you're going to have that sensation of wanting to burp all the time because, again, your stomach capacity is smaller. So when you eat just a little bit of food, it displaces that air that you took in while you're eating. And that's also why you can't have straws. You can't use straws to drink things because that sucks in a lot of air. That's why you can't have carbonation, because that has, of course, a lot of air pumped into the water or whatever that you're drinking. So you're going to have a lot of burping. Anyways, those are 10 things to expect after weight loss surgery. Again, this was a 19-minute video. I didn't mean to make it this long. I hope to get through these quicker. Maybe next time I'll do 5 and then make 5 more in a different video. But, yep, that's my video for today. I love you guys, and I hope you have a great day. God bless you.